I know that many Albertans still have concerns about schools. This anxiety is natural. Jurisdictions across Canada and around the world are facing the same challenges and uncertainties with schools as we are now. As I've mentioned before, there is no perfect path through this pandemic. Every option comes with its own risks. We must make choices based on the best information available at the time, monitor the information and the situation closely, and then adapt as needed to protect the health of our students, teachers, and staff. I know that many of you have questions. That is why we are holding these availabilities every day this week. I want to strive to answer any questions that you may have to the best of my ability. We are still learning about this virus, so I do not have all the answers, but I will always provide the information that I have and what we are doing to learn more. To date, AHS has confirmed 16 cases that were present at 16 different schools while infectious. I know that some have asked why we are focusing on that number when other sites are reporting higher numbers. The answer is that we are striving to help parents best understand the risk of exposure that their children face. I think it is important that I explain why I feel this is the correct approach. As a parent, learning that a teacher or other student who were never in the school while infectious and contracted COVID-19 at a party or while on vacation does not help me understand if my child is at risk. In a school context, there is risk for students and staff only when an infectious person has been present that they may have come in contact with. The best way to assess the safety of schools is to track and monitor the number of cases and schools where an infectious case was present, as well as schools where transmission has happened on that site. Other numbers are not relevant to school transmission risk and simply cause confusion and anxiety. To take an example from a different setting, if we reported every COVID case in any staff member who worked in a continuing care site, whether or not they attended work while infectious, there would be no benefit to the site or the public, and it would lead families of residents to be concerned that their loved ones were at risk when they were not in any danger. While we put precautions in place with single cases, we publicly report only when 2 or more cases are confirmed with transmission in the facility to provide this information when it is relevant. We have always committed to complete transparency to all those connected to a school when a case is identified. That is why mandatory notification is in place for all school cases. All parents, students, and staff who are part of a school community where an infectious case is identified have been receiving and will continue to receive an alert directly from the school whenever one of these situations is identified. There are times when a school sends out an alert before the public health investigation is complete, and so some of these alerts may in fact go out before we understand that there was no infectious case in the school. This can cause a discrepancy in our numbers. In addition to this commitment to transparency for those related to a school, we outlined several weeks ago a commitment to provide public reporting in a way that is similar to all other outbreaks, with a cutoff of 5 or more cases in a school. What we have heard over the past few days is that the public would be reassured by knowing that we are formally reporting even more than that. I have heard the desire for us to begin reporting outbreaks of even 2 cases, as well as alerts where schools have had a case present while infectious. We have committed to being responsive and adapting our return to school plan to meet students, parents, and teachers' needs. That is why today we are launching a new online map to help parents track where there may be a risk in their children's school. The map will list every school where there have been 2 or more cases in a school setting within a 14-day period, where disease could have been acquired or transmitted in the school. So far, none of the 16 schools that AHS has reported to us have met that threshold. If needed in the future, the map will also list schools that have shifted into scenario 2 or 3 to protect the health of students. I know there is interest in adding all school alerts with single cases to this public reporting as well. we are exploring ways to report all the schools where a single case has been identified who spent time in a school while infectious. We are working to understand the perspectives of school stakeholders on this, as it is important that we balance transparency and confidentiality, as we always do. I will update Albertans on this work in the coming days, and we are committed to continue improving the online map. This is a difficult time, and I know there are a diversity of perspectives that come from the same place, our shared concerns about the health of our children and colleagues. I would urge Albertans to remember that it is okay to disagree, but also remember that even well-meaning words and actions can impact the health and well-being of others. Focusing on the official numbers and situations where a risk of exposure has been identified is the best way to understand what is really happening in schools. I also want to highlight that as of today, Alberta has 1,585 active cases throughout the province. So far, the school cases identified have all come from community transmission, not through transmission within the schools themselves. As mentioned yesterday, the more cases we see in the community, the more likely we are to see COVID-19 in schools. I know that there are those who are concerned about face coverings for various reasons. And again, as I said earlier, I think many people have different perspectives coming from what they believe to be best for their families and communities. And what I would say in terms of what information I've used to make my recommendations for face coverings, and in schools in particular, the requirement for face coverings in that setting is based on looking at the overall sum of evidence that's available from around the world. We, of course, don't have randomized controlled trials of community face coverings because COVID-19, while we have had about 6 months, we haven't, of course, had that time to set up a randomized controlled trial in a community to document where an intervention of face coverings is used and where it's not used and to look at the difference. But what we do know is from experimental evidence looking at how face masks block the expulsion of droplets and infectious particles, and also looking at observational studies that have looked at the impact of face masks in different settings, and looking at the review of evidence around the potential harms of face mask wearing. There's very little evidence to demonstrate that there are harms to wearing face masks, and there is quite a lot of evidence if you look at that overall collection of all the studies that have been done to suggest that when someone wears a face mask, essentially the way that it works, if it's a medical face mask that has been standardized to provide the filtration that's appropriate, then that face mask can both protect the person wearing it as well as those around them, because it prevents particles from coming in while they're breathing in, as well as catching particles that they're breathing out. When you use non-medical face masks, whether that's cloth face coverings or other grades of face masks, it doesn't have the same degree of protection of the person wearing it, although there is some emerging evidence that would indicate that wearing those kinds of face masks may, if you're around someone who's infectious, may reduce the amount of infectious particles and potentially reduce the chances of having a severe illness if you are exposed to COVID. But the non-medical face masks are most important when someone is wearing it to protect those around them.